Is your voice hoarse, cracky, or has gone into weeks? And you're thinking it may just be a common cold. What if it is not what you are thinking of? What if it is something more serious? Hi, I'm Dr. Isi, a mom and a medical doctor. It's been a while and I've really missed you guys so much. Today, we shall be diving into a surprisingly common issue, which is voice changes or change in your voice. I know sometimes when you have change in your voice, you may have been told, oh, it's just a common cold, don't worry, your voice will come back, it's just this, your voice will normalize. What if it doesn't come back? What if it is something more serious? So stay with me in this video as I'll be breaking down the common causes of change in the voice, when to know that this change in the voice is serious and see your medical practitioner, and things you can actually do at home to relieve you of change in the voice. Before we go into the causes of change in the voice, it is important to understand that your voice is produced by the vocal cord. And the vocal cord is a band of muscle tissue in the voice box, in the larynx. So if there's an issue within the larynx or on the vocal cord itself, it's going to affect your voice, is going to affect your sound formation. Imagine if there is a growth, there is a tumor, there is a weakness, there is ulcer, it's going to affect your voice production, right? Now let's go into those causes of change in the voice. I'll be starting with the most common causes of them. Number one there is laryngitis, which is simply an inflammation, an infection of the larynx, of the voice box area. Laryngitis can be from bacteria, it can be from viral, and viral laryngitis is the commonest type of laryngitis. And this viral laryngitis can be from COVID, any form of viral infection, COVID, a common cold, a flu, and this change in voice usually do not last for a very long time, within a week. So once the viral infection subsides, the change in voice will automatically resolve. All right. Now, the second common cause of change in the voice is voice overuse, voice abuse. This is commonly seen in those who are often using their voice. Their occupation involves them using their voice at every time, like the singers, the teachers, the communicators, all right? And it usually results after yelling for a very long time, shouting, using the very wrong key. When I was little and we were in the junior choir, yes, then for our master was okay. Those of you that can sing soprano, we don't even know which is which is soprano, which is alto, and the rest of them. I end up singing a very high key, which I wasn't supposed to sing. And at the end of the day, I came down with a change in my voice and I was hoarse for some days. I know some of you have also experienced this. Another common reason for a change in voice is if you have allergy or you have problem with your nose, you have sinusitis. So when you have sinusitis, you may experience mucus dropping down from behind your nose into your throat, and this can cause an irritation in the larynx, leading to a change in your voice. Same as allergy. So if you have allergy, you may actually come down with a change in your voice. Then it could be as a result of reflux, gastroesophageal reflux disease. This also can lead to irritation of the larynx. Some persons feel some form of metallic or sour taste in their mouth, especially when they wake up in the morning, and this category of people will notice that the change in their voice is usually in their morning. So the fifth commonest reason is smoking and use of alcohol. This also cause irritation to the larynx and they can lead to a change in your voice. Now let's go into other causes, although they may appear less common, but if they happen to be a reason for a change in your voice, you may require a medical care, you may require a medical intervention. Number one there is vocal cord polyps or nodules. They are not the same, although in either of them, both vocal cord polyps or vocal cord nodules. And vocal cord nodules usually happen in people who have, over time, have had voice misuse, voice abuse, overuse of voice, like in the aforementioned people, the singers, the preachers, the teachers, those who are always in constant use of their voice. So they may develop a little growth over their vocal cord, and this can alter the voice, and the voice may appear very strained, very weak, and sometimes breathing as if you are just straining to talk. All right, so the next one there is vocal cord paralysis. This happens when there is an injury first. It can also happen from a viral cause or even a stroke. So it's something that's required an intervention of your medical practitioner, and it tends to cause a very weak voice, and sometimes the voice may just completely go. All depends on the intensity, the level to which the vocal cord is affected. It can also be a direct trauma to the larynx. Probably they had road traffic accidents, stab injury, or if someone who had surgery, especially thyroid surgery, can cause trauma to the larynx, trauma to the nerves that supply the larynx. So when this happens, it can affect the larynx, can affect the vocal cord and lead to change in the voice. Another less common but serious cause of change in the voice is tumor, which could be benign or malignant. And this, I would say at this point, that if you have been having a change in your voice for more than 2 weeks, 3 weeks, persistently, it's not resolving. It's not resolving. It's just progressive. You need to see an ENT doctor. You need to see a medical doctor to get evaluated to rule out laryngeal tumor, especially the malignant one. And I'll be more worried if this is discovered in someone who smokes or takes alcohol. Yeah. So if you are someone who smoke, take alcohol, you have been having persistent change in your voice over a period of time, 2 weeks, 3 weeks, it's not resolving, my dear, this is the time to seek for medical intervention. All right. Then the number five less common cause could be psychogenic, especially in those who are emotionally stressed, having emotional disturbance, having some form of psychological issues. They can have a change in their voice, and this is termed as functional voice loss. So let us look at the red flags. When should you go and see your doctor? When you have a change in your voice. When should you be worried? Number one, if the change in the voice has lasted beyond 2 to 3 weeks, it's not resolving, it's been persistent, it has been progressive, my dear, you need to see your doctor at this point. Number two, if you have history of smoking, if you smoke and you are having a change in your voice. The next one, if you are having difficulty swallowing or difficulty breathing, you need to see your medical doctor as soon as possible. You're having a change in your voice, and at the same time, you're having difficulty swallowing, you're having difficulty breathing. You need to go and see your doctor. If you have a lump, either a feeling of lump in your throat when you swallow, or a lump, a swelling, a mass, a growth you can see on your neck area, you need to go and see your doctor. Another reason why you should be worried when you are having a change in your voice is if you are coughing and at the same time coughing out blood. If you are having a change in your voice, you are coughing and you are coughing out blood, my dear, you need to see your doctor. Also, if you are losing weight, you notice you are losing weight, your clothes are no more sizing you, they are not becoming loose. People start noticing that you are losing weight when you are not trying to lose weight at any time. You need to see your doctor for evaluation. All right. Now, there are some things you can do for yourself, some self-care you can give to yourself if you're having change in your voice, a strained voice, a weak voice, whatever voice you just noticed your voice, there's change in your voice, not as it used to sound before. These are the things you can actually do for yourself. Very first one is you have to drink a lot of fluid, you have to drink a lot of water, because you don't want your cord to get dried, as dryness of the cord can worsen your symptoms. So you need to get a lot of fluid, you need to drink a lot of water. You can also drink some soothing tea that are comfortable for you, that are healthy for you. Then you need to stop using your voice. Stop using your voice. If you are a teacher, a singer, a preacher, or anyone whose job involves talking and using the voice, you need to take some break off talking. Just rest your voice. In as much as your voice is cracky, is hoarse, don't whisper. Whispering is going to worsen it. So don't whisper. Talk the normal way you can talk, and make sure when you are talking, the person that you are talking to is not too far away from you. All right. So don't whisper, and at the same time, don't overstrain your voice. And if you are someone who is already prone to having gastric reflux, you have history of dyspepsia, you're having reflux, or okay, let me explain it. Sometimes you may say, okay, what's all this reflux all about? You feel there's the content of your stomach is regurgitating, is moving into your mouth, into your throat. You may be having a reflux. So if you have any case of reflux, you need to take care of the reflux. You need to take your medication for reflux. Then the next thing you can do is to visit the nearest hospital to you, especially if the change in the voice has lasted beyond 2 weeks, so that you can be evaluated. By the time you get to the hospital, your doctor will have to look into your throat using a camera, using all the necessary tools to check your throat, finding out what exactly may be going on. If it requires further investigation, well and good, you'll be requested to do all that, so that the reason for your change in the voice will be gotten on time. Because knowing the cause on time and addressing it is very, very essential for a good outcome. So, my dear, your voice is your identity. Don't abuse it. Don't misuse it. And if you notice any change, don't ignore it. Don't ignore it, because detecting it and addressing it on time will give you a better outcome. Have you ever experienced a change in your voice in your life? Have you ever seen someone who has experienced a change in their voices? Please let me know in the comment section. I hope you enjoyed this session and I wish to see you in the next. Please do not forget to like and subscribe to the channel if you haven't subscribed, so that you can be having educative moments as this. All right, guys, see ya in the next. Bye.